today I would like for you to meet Dr. Meena Malhotra, who is an internist on staff at Glenbrook Hospital. Today we're going to be speaking about osteoporosis. Doctor, can you tell me what is osteoporosis?
Well, Laura, as the subject for today is osteoporosis, osteoporosis is also called as silent bone thief. It creeps up on you very silently and over many decades. You don't know when it is happening, and finally you know it when you break a bone or have excruciating pains in the back or some other part of the body and you discover that there is a fracture. It is a very, very common and a prevalent disease. Almost 44 million Americans are affected by this. Men to women, till some times ago it was thought that only women are affected by that, but men are not exempt. There's one man to every 4 women who is suffering from osteoporosis. A lot of these 44 million people do not understand that they have the disease unless and until something happens, as I stated before, a fracture or a fall leading to a fracture. Osteoporosis is a disease where your bones become fragile. They lose the calcium. If you think of bone as a sponge which has all the calcium absorbed and studded on it, with the age and because of a lot of factors which we are going to talk about, the bone loses the calcium and it becomes like a sponge which is soft. Now think of it, when you put the weight on a sponge, what happens, how it gives away. That's what is happening in your body when you put weight on an osteoporotic bone, on your hip, on your spine, and everywhere else in the body. The bone crumbles. And what we have learned, that's not what the function of a bone is. Bone is a skeleton. It's supposed to support your body. When it is not supporting, it compresses as you put on the weight and it hurts. When the disease is this far advanced that the compressions are happening, a spontaneous compression fracture happens, unfortunately that's when people seek medical attention for it. But the good news is this, that it can be caught very early. If you go for your regular physicals, there are ways to screen the disease, and there are criteria which can be discussed at your next visit with your doctor. So please don't forget your annual physical. Laura?
So Dr. Malhotra, how is osteoporosis diagnosed?
Okay, as Laura, I was talking about, the best way of diagnosis is screening, because by the time the presentation is there, it's always too late. So when you go for a physical, everybody who is menopausal women, men older than 65 years old, people who are on steroids or immunosuppressive medications, like Imuron or other medications to suppress their immunity for autoimmune disorders, people who take the medications for epilepsy, all these people should be screened for osteoporosis. Once again, the major group is menopausal women and men older than 65 years. And then at a younger age, if you take any of the high-risk medications. The test can be as simple as doing a simple ultrasound in the doctor's office, but the standard of the care is the bone density testing, which is also called as DEXA scanning. It's a very simple test requiring the radiation 1/10 of what is needed in a chest x-ray. So it's a very simple test. The equipment does not make you claustrophobic. Nothing comes close to your mouth, just like MRI. You go in a scanner, they check the density through the radiation waves in your spine and on your hip. And they compare it with the young adults and also other people of the same age group. And it gives a reading which your doctor should be able to analyze and give you if you fall into osteoporosis group or you fall in osteopenia, which is the stage before osteoporosis. That's when your skeleton has started to lose the calcium. It is not enough to label it as osteoporosis, but it is getting there. It is very important. Till many years ago, it was thought that osteopenia does not need to be treated, but now things are changing. Now osteopenia is taken just as osteoporosis, because it eventually, many years down the road, it almost always turns into osteoporosis. So now we take osteopenia as seriously as we used to take the osteoporosis and start treating it at that same time. Laura?
So doctor, can osteoporosis be reversed?
It is something which you once get it, you live with it. It's like diabetes or hypertension. It is something which can be controlled with medication, but it cannot be cured. Sometimes, if we go a little bit back up here and understand the physiology of the disease, your bone is like a bank in which you deposit calcium throughout your life. And at the end, in the 4th stage of your life, after 50 years, you start using the bank which you have collected over many, many young years. It is very important for the teenagers, young children, to be on a high calcium diet, because that's when your bone is building and you achieve the maximum bone mass between 20 and 35 years of your age. So exercise and a high calcium intake during the childhood and the teenager years are as critical as taking the calcium at the later phases of your life. The bone, at this point, the rate of bone formation is more than the rate of bone resolution. Let's put it this way: the rate at which the bone is formed is higher than the rate which bone is dissolved. And that's why at that time you are collecting the bone mass. If you do not have enough calcium or enough exercise in those periods of your life, then you never reach the peak bone mass, which is of ultimate importance when you will start losing at a higher rate than accumulating it. When you become menopausal, or after 65 years of age, the rate at which the bone dissolves is higher than the rate at which the bone is formed. So slowly you start emptying your bank, and there comes a time when there is not enough calcium in your bone and you get osteoporotic. So the treatment strategies, there are 2 phases. One is to build it properly, and the second is when it starts dissolving more, at that time to give you the medication to stop or at least slow down the rate at which it is dissolving. And most of the treatments we have these days mainly they focus on these 2 phases of the bone metabolism.
So doctor, what is the recommended dose of calcium for, say, a postmenopausal woman?
Oh, I see. Well, I think here we should talk a little bit more about what are the treatment options for osteoporosis and what can we do before we come to that. As we talked about, calcium and vitamin D is of utmost importance since the day you are actually born, because these are the things which are building your bone. The calcium through the diet, through the supplements, and we'll come to it, what is the right way or what is the right supplement to it. Then vitamin D is of utmost importance. The third thing is the weight-bearing exercises. If you do not put weight on your bone, the metabolism slows down and it starts losing the calcium. So weight-bearing exercises during the childhood and the teenage years is as important as it is in the later phase of the life. So exercise, calcium, and vitamin D. These are the 3 things which you do to build your bone. Let's talk about here how and from which source we can get the calcium. Through the diet, as everybody is aware of, Dairy products are very, very rich in calcium, and it is also found in green leafy vegetables. A glass of milk, almost 8 ounces, have 300 milligrams of calcium. 8 ounces of yogurt have almost 200 milligrams of calcium, and 1 ounce of cheese also has 200 milligrams of calcium. This is approximately. A person's requirement of calcium is 1000 milligrams every day for women till they become menopausal, and for men till they are 65. After that, this increases up to 1200 to 1500 milligrams a day. There is a little change in here. Some times ago it was thought, well, calcium is good, the more is better. Unfortunately, that's not what the case is. If you go over than the recommended doses, then there is a very high risk of forming kidney stones, and so it is not advisable to go really up more than 1500 milligrams of calcium a day unless and until you have some problems in your intestine or some kind of disease which does not let calcium get absorbed from your intestines properly. Now, regarding vitamin D, you know, everybody knows that and reads in the school that when you are in the sun, your skin makes your own vitamin D, which is a great source of vitamin D. Unfortunately, in Northern America, sometimes we don't have that much sun available to us. So that is why the role of supplements and the sources through the diet comes. The diet, the calcium and vitamin D is present in the dairy products. A note here is skim milk and fat-free dairy products are richer in calcium and vitamin D than the full-fat products. So again, another reason to try and take the skim milk than the full-fat milk. You get more benefit and less fat. Can't get better than that. So the vitamin D sources, again, as we said, dairy products. The recommendation these days are almost 1000 international units a day. Again, of note here is, till a few years ago we thought 400 to 600 international units of vitamin D are the recommended dosing. This is changing now. Now the standard recommendation is 1000 international units of vitamin D a day. Well, some vitamin D is available in many forms in the drugstores. Which one? Is one better than the other? In this case, yes. We don't say generic or brand name, but cholecalciferol, that is the medical name for it. Vitamin D3, that is the best and the most active metabolite of vitamin D to ingest, and it is better than any other kind of vitamin D available. So yes, if you have an option, that will be the way to go, and 1000 units of it every day. So here we covered calcium and vitamin D, and do not underestimate the exercise. The more weight you put on your bones, the stronger they get, and the more calcium and vitamin D they accumulate to reach the optimum bone mass. Now the second phase of treatment, which comes if the rate of the rate at which the bone is dissolving is higher, and that's where we target the medications which are in the market. If you have heard Fosamax, Actonal, and now Boniva. These are the medications which decrease the rate at which the bone is dissolving. These are the medications which can be taken from once a day, once a week, and now once a month. The new thing is now it's an injection coming in there which can be taken once every 3 months. These medications are not without the side effects. As a lot of you who are taking these medications know, these are the pills which come with 1 hour of walking with them, mandatory. These pills are harsh on your food pipe, on your esophagus, if they sit on it. So the recommendation is when you take these pills to be upright for at least 45 to 60 minutes. And upright means upright, not sitting on the couch comfortably, relaxing, watching the TV. It comes very clear. Upright is upright. You better take the pill and walk. Go for a walk, get ready, dry your hair, do whatever you want, but stay upright. and it needs to be taken on empty stomach with 8 ounces of tap water. No cola, no milk, no drink. 8 ounces of tap water is what flushes this pill down your throat, so it doesn't bore an ulcer in your food pipe. These pills are actually very good, and they decrease the rate at which your bone is dissolving. And so ultimately you come to a positive balance and you start building some bone after you have been on this medication for a long time. There is some evidence, and this is still in research coming in there, that these are the pills which you can take the holiday from. You take it for 2-3 years and you can probably get off them for a year or few months, then get back on them, because that's how long they stick in your system and they keep the bone in the correct phase of the metabolism. Laura, I think we covered most of the treatment options which are available. So let's see if you have any other question.
Doctor, you did a great job stating some of the calcium with the food sources. Can you tell me more about maybe some possible side effects from the supplements?
I see. Okay. Well, the market is flooded with calcium. If you go to buy a calcium or vitamin D, you will probably see 15, 20, even more. Lot of brands, lot of type of calcium getting sold. There's coral calcium, there is Tums, there's calcium citrate, there's Oscal, all kinds of calcium. So is one better than other? Well, here's the bottom line, and this comes in reading the labels in there. Calcium carbonate, which is there in Tums, or calcium citrate. These are the two main calcium salts. Calcium carbonate has a little bit more elemental calcium than calcium citrate. 40% is elemental calcium in one salt of calcium carbonate and 20% in calcium citrate. A good way of knowing in a pill how much calcium is there is on the label. It always reads percentage daily value of calcium, and it will give you a number: 20, 10, 40, 50. Just add a 0 next to it, and that's what it tells you how much calcium in this one pill you are getting towards your 1,000 to 1,200 milligrams a day. If it says 20%, that means one pill has 200 milligrams of elemental calcium. And it does not matter you take it in the form of Tums or calcium citrate. You have to be careful about the food. The calcium carbonate can be taken, has to be actually always taken with food in order to get the best benefit. Calcium citrate can be taken either way, can be taken without or with food. So doesn't matter, whichever one works good for you, whichever one fits good in your schedule is good to go. Just keep counting towards that 1,000 milligrams and make sure by your diet or by the pill you get to that number, and that's really all it matters. I'm not sure if coral calcium is better than the regular calcium. Well, I think I cannot take any stance about, but medically it is proven that as long as you get your 1,000 milligrams of elemental calcium, that's what it matters. Does not matter which source it is coming from. Very unlike like vitamin D, in which they say D3 is the way to go, because that's where you get the best benefit.
So Dr. Malhotra, can you tell us what happens if a patient is not treated for osteoporosis?
Well, Laura, that's an excellent question. And remember, if you did not go for your physical, most probably you will be the one who won't be treated, because you won't know till you have a fracture. So a lot of people who don't go for their physicals, when it is not diagnosed, or if you get diagnosed but you don't keep up with the treatment, what happens then? Hip fracture. Hip fracture is a name which everybody is scared of, and there's a reason to be scared of. A hip fracture, a year out, the mortality from hip fracture is 20%, even in today's age and date of modern medicine. So again, I want to say it, if you receive a hip fracture within a year, there are 20% chances that you will not be alive. Wow, that's a huge, huge number. And it all doesn't happen right after the hip fracture. That's where within a year is a big thing to consider here, because the complications which can follow after the hip fracture, like forming a blood clot, the blood clot migrating to your lungs, or any kind of cardiac, heart problems, lung problems, and all these things just add up to the mortality and morbidity from the hip fracture. Again, at 6 months after the hip fracture, only 15% of the people will be able to walk unaided. So if you were just walking fine, fell, broke a hip, at 6 months there are only 15% chances that you will be walking without an aid, meaning without a cane, a walker, or even worse, in wheelchair. And that's why hip fracture is still a very scary disease to get. You don't want to get there, and that is the reason the osteoporosis should be treated and be caught early, because even trivial falls, which are common as you grow older, it doesn't always have to be your own neuromuscular problem. It can be as simple as tripping over a cord, tripping over a rug, tripping over a step or the sidewalk. But if you fall and your bones are weak, the risks of breaking a hip is higher. And what we all just learned about the hip fractures, that is somewhere nobody wants to get close. And when we talk about the healthcare cost, one hip fracture costs $40,000 in healthcare costs. That's an enormous amount to take medically, financially, and it's a big impact on your health and family. 25% of the people who have hip fracture will end up needing a nursing home placement 6 months to 12 months down the road. And this is not including the short rehabilitation period which almost everybody go to gain their exercises. This is after the hip fracture, just they are not able to take care of their activities of daily living, leading lot of nursing and aid support, ultimately leading to a nursing home placement. So this is another reason why you should go for your physical, get your osteoporosis checked out, and stay on top of it before it leads to any of these problems. So that's one thing which can happen if you don't treat osteoporosis. There are a few other things, because there are a lot of other bones in the body other than the hip. We always talk about the hip, and the second most common place we talk about the spine. Now spine can, as you know, spine acts like your weight-bearing column through which the weight of your body is transmitted through your extremities, to your legs. As these bones become weak and they become like sponge, through the walking, simple movement can cause them to crush the bones. And if you will think, just a thick sponge, put the weight on it and it gets crushed. It's exactly looked like this, and that's called as compression fracture. This can lead to severe back pains, upper back or lower back pain, and cause lot of debility. Unlike hip fracture, all of these compression fractures are not caught early, because a lot of people just try to tough it out at home. The pain in the back, they just take some medication and do not seek medical attention. So it is just not a regular back pain. It might be a compression fracture. Please get it checked out, because that's what leads to bending of your spine, scoliosis, kyphosis, as you see, lot of elderly women and even young people who are on medication gets in their spine bent down because it all starts getting compressed just like a sponge, and that's another manifestations of untreated osteoporosis. This is the reason why osteoporosis should be treated in order to avoid this debility. The last thing why it should be treated is, have you heard of old saying, the cold wind hurts my bone? And that is when the calcium is less in your bone, anytime you are putting the weight on your bone, there are multiple small micro fractures running through the bone, and the bone is just soft. So each time the weight goes on, some get pressed and it causes a lot of pain. It's worse when the weather is cold or chilly. There are reasons other than osteoporosis, osteoarthritis contributing to it. But if your bone is weak in calcium, it hurts. Lot of reason for people to have leg pain, back pain, hand pain, lot of debility associated with it. Another reason why the osteoporosis should be treated. Laura.
Doctor, many people do confuse osteoporosis with osteoarthritis. Can you briefly go into the difference?
Well, even though these two they are totally two separate diseases. They begin with the same word osteo, and osteo meaning the bone. Osteoporosis, porous, porosis, where your bone is porous. It lacks calcium, it's fragile, it's weak. Osteoarthritis is the most common type of arthritis which affect the joints and lead to lot of pain in the joints like knee and hip. Osteoporosis is a disease of bone and osteoarthritis is a disease of joint. And I think further osteoarthritis needs a whole separate day to discuss about it, and we will come to it someday in future. But for now, I think it is suffice to say that osteoporosis and osteoarthritis are two different diseases. The treatment is different, but they both cause a lot of pain and suffering. So it's good to stay on top of them and treat them before they get you. Yes, Laura.
Thank you very much, Doctor, for your time.
You're welcome. I hope this answered a lot of your questions, and I'm sure you will think about it, and there will be a lot more questions coming in the mind, 2 a.m. in the morning, 8 o'clock in the morning, anytime you think about it, when your leg hurt, when your feet hurt, please visit National Osteoporotic Foundation. As we speak, the website and the phone number will be popping up on the screen. Take a moment, note it down, visit it. When you hurt, I think it will take a bigger impact at that point. That doesn't mean you cannot visit it when you are not hurting. It's always a good idea to stay on top of the things before they get on top of you. So please call your doctor, schedule for your annual physical. That one well visit to your doctor can take you long ways, avoiding a lot of complications of these diseases which closely and just sneak up on you. Thank you.